Hello everyone, welcome to this video. Thank you so much for joining me today. My name is Dr. Farzana Hoque. I'm an associate professor of medicine and academic hospitalist practicing in the US. In this video, we will cover a couple of tips that you need to know if you are looking for a hospitalist job. Maybe you are a resident just coming out of residency and now looking for a job. Maybe you are a early career hospitalist, now have few years of experience of working as a hospitalist and now planning to looking for another hospitalist position. Regardless of your career stage, this video will highlight a couple of tips and techniques that you can utilize and have a great position to achieve that dream hospitalist job. So let's first begin. Before you go ahead with your hospitalist job search, you need to sit together with yourself and identify your priorities, identify what will be set criteria that define that ideal hospitalist position. For example, first you need to ask the question that, okay, do you want to practice in a community hospital setting or do you want to practice in a big academic tertiary healthcare center? And both has its pros and cons. There is no perfect answer, but you need to know like good things and challenge on both aspects. For example, I am an academic hospitalist where you will work in a big academic center, lot of a specialist team, lot of cutting edge technologies. In big academic center, you will work with trainees. The challenge is the compensation is much lower than the community hospital. In many of the academic hospitalist position, you are not getting that RVU or bonus compared to the community hospital. Now let's focus on community hospital. So in community hospital, at least you have to see between 20 to 30 patients. I'm giving you a range and which is right almost a majority of community hospital across the USA. Patients may be less sicker than the academic setting. Maybe, you have lot of specialty and whenever maybe you have very sick patient, maybe, you will transfer them to big nearby tertiary center. In community hospital, the maybe you will get signing of bonus, you will get bonus on your productivity, maybe you will also get RVU that will give you at the end of the month or year a limit a specific amount of money. So all those things are very important for you to assess. And then, are you a physician who wants to work during the nights? Because many people they only love to do night. Many physicians they do not like nights. Many physicians are okay, they want to mix up both night and day. So these are very important questions that you need to figure out before you are reaching out to recruiter or before you are going for hospital list job. Also, you need to ask yourself that are you comfortable with the procedure? Because many hospitalists maybe they do not prefer procedures. On the other hand, many of them maybe love procedures. They want to do ultrasound guided different type of procedures. And finally, it is also important to ask yourself that okay, if you have any visa requirement, what are the ideal program for you? If you are on J1 visa, maybe you have limited option compared to if you are an IMG or like citizen or green card holder. So all those things you need to ask yourself first. So after you know that, okay, whether you are going to community versus academic setting, night, whether you are doing procedure, then move ahead to create your CV and cover letter. So when you are creating your CV, couple of things you need to remember. First, If you are an American graduate, or if you are an citizen, no visa requirement, that's wonderful. But it is better if you mention that. That shows that okay, you do not have any string, so you can start right away work. They do not have to sponsor the program. On the other hand, if you are on J1 visa or H1 visa, you have this visa requirement. You need visa sponsorship from this hospitalist program. It is also important to mention that in the first page. I will advise you to mention in the first page. What other things you can mention in your CV? As hospitalist, many of the time, truly regardless of whether you are in academic setting or community setting, you will be asked to involve in multiple committees. You will be also asked to participate in at least few quality improvement projects. So, as a resident or as an early career hospitalist, if you already have experience of involved in committees, involved in quality improvement projects, this is a perfect opportunity for you to document that. So highlight which are the committees or QI project you did, and also mention, which things you achieved, which things you have learned from those positions that you will utilize in your incoming, the new position. What else you can add in your CV? If you are proficient in multiple electronic medical record, because nowadays every program has EMR, so if you have experience in working with multiple EMR, that is also good option to document that. If you are interested to do procedures, highlight that, which procedures you are comfortable, maybe how many you did. These are always great to include in your hospitalist CV. So now you know, okay, which position is ideal for you, which setting. Now you have your CV, your cover letter. Now, the third step is whom to reach out for that ideal position, how you can get called for interview. So, for that, I will highly recommend you to start with your inner circle. And what do I mean by inner circle? Start with the program where you did your residency. You have your graduating residents, you have your senior residents, you have your attending physicians, you have your mentors. So reach out to them, tell them that, okay, now you are looking for a hospitalist job. These are your criteria. What program do they recommend? Many times you will be surprised that, okay, how people can give you wonderful and very useful information. They may give you name of couple of great programs. They may also give you heads up that okay, this program has this drawback. Do not go there. So always asking with the people, understanding their perspective, experience is very, very helpful. So after you have leveraged your inner circle, now you can also utilize LinkedIn, different, professional website such as Practice Match. There are a lot of other websites to connect with the recruiters. So recruiters will ask for your CV. They will want to talk to you maybe for a few minutes to understand, okay, which program do you want, and then they will give you the like description for whatever position they have within their ability. I will advise you when you are sending CV to the recruiter, make sure to mention your name in the email subject line, because the recruiters, they get lot of CV, lot of application all the time. So if you mention your name in the subject line, it will be much easier for the recruiters to find out your email, to find out your CV and application. So now you have your cover letter, CV, you spoke with your inner circle, you spoke with the recruiter. Now you got interviews for the hospitalist position. Now, what is the tips and techniques you need to remember during that interview? First and foremost, dress professionally, act professionally. It may sound very simple. However, over the years, when I am the interviewer for hospitalist position, I saw that sometimes people show up with their scrum. I understand that, okay, they are busy, but if you are coming to an interview, at least take that time to dress professional, to act professional. Then secondly, be prepared that, okay, which questions you need to ask, which information you need to know to make the decision whether you will sign up with this hospitalist program or not. For example, ask them that, okay, which things they are proud of, which things they are doing well, what are the like new changes in the program, what are the changes they are anticipating. If you get chance to meet up with the hospitalist besides the leadership during the interview, talk to them, talk to your potential colleagues who may be working there. They have the front line experience. They know very well which things are great there, which things need to work on, which things are challenging. So talk to them, be upfront with them, ask them what is their experience, which things they enjoy, what is keeping them there, and which things they believe that need to be changed. You do not have to frame it as challenge, but you can always ask which things they feel that need to be changed or modified. After you have the understanding of this workflow, make sure to ask how do their backup system work. For example, if somebody is sick, having any family emergency, physical health issue, how does it work? What is their backup structure? So ask them about their malpractice coverage because as a hospitalist, we see a lot of sick, complicated patients, regardless whether we work in academic center or community center. So we have to have very clear understanding of the malpractice insurance. Do they have tail coverage? Ask them clearly. What about their contract? Do they have any non-compete? You need to know beforehand, before signing the contract, if they have any non-compete issue or any other restriction of working there. That is always advisable. Know early rather than, after you sign the contract and now you cannot go anywhere. So ask all those important questions during the interview. And after you get the contract, review it by yourself. If you feel that, okay, no, you need to contact with like any senior physician or anybody who has very depth knowledge about that contract, it could be like, any legal personally, any lawyer, do that. Make sure you know what is in the contract before you sign the contract. And also have a understanding like what is their compensation structure, what do they have, any sign on bonus, do they have any like paid time off, PTO, do they have any kind of RBU, what is their productivity measure. It's very important to have clear understanding before you sign up that contract. I hope you find all these advice helpful. If you have any questions or comments, please put it in this section. I would love to know that. If you like this video, please like this video, share with your friends, and subscribe to this channel because your aspiration, your support, inspiration means a lot to me and keeps me motivated to make more useful videos for you. I will see you in the next video, and until then, take care, be prepared for your interview, and land in a dream program. Best wishes. Bye-bye.